that follow you around then?
Yeah, it does. Yeah, so we talked about the components of the tape. So yeah, 97% cotton, 3% nylon, so it's got a bit of stretch to it. The difference between this and rigid tape is rigid tape doesn't move, and this stretches quite a lot. When you get the package from Rocktape, obviously a little package, and you got a brochure there as well, which I just ripped.
Yeah.
But that's got a few.
You've got special Rocktape scissors.
Yep, Rocktape scissors. You need scissors with kinesio tape. So with rigid tape, you can break with your fingers. You can rip. So kinesio tape has a paper backing. Okay, so you actually need scissors to cut it. So as I said, so we're putting tape on the body for receptor information, so not really to hold anything in place. What I was getting to before was when you actually have rigid tape on, the idea for your daughter was to keep her ankle still. So that actually doesn't work to a point, so it'll probably work initially and you'll get that tightness and that feeling of stability, but rigid tape actually turns into kinesio tape after probably about 10 minutes of running, because it'll give.
Stretches and
Yeah, it'll stretch and it'll give, and the ankle will still move.
Yeah.
So it's actually not holding the ankle in place. It's giving feedback to the brain for proprioception and trying to hold that in there. So it just becomes tape on the skin, which is still doing its job because it's giving feedback. As we said, once tape is on your skin, it's giving feedback to your brain. Once there's information in your brain, the brain has to react and give some other feedback.
Yeah.
So why would you use tape on someone? So for me, if someone has got a sore knee, so I would go through, I would massage them, try and make their knee feel better, and then I would tape their knee afterwards. And it, again, my hands provide input, but also the tape provides input.
So by
well.
taping the knee,
Yep.
how would that benefit the knee, helping it?
So there's definitely two major benefits: neurological,
Yeah.
as we talked about. There's information there, and the brain will
The
start
brain will be aware of that.
be aware and maybe focusing on the tape a little bit more,
Okay.
rather than the actual receptors that are causing a bit of pain in the knees. So it's a different kind of stimulus.
Yeah.
Similar to when you bump your knee, when you bump your toe, what do? You rub it.
Yeah.
So that kind of stimulus is different. So putting tape on is a different stimulus as well.
Okay.
So you're downgrading that sort of receptor stimulus by putting tape.
And is it in a way supporting the knee, or is it literally just feedback?
Not really.
Okay.
Not really. Again, not holding anything in place.
Yeah.
But people will say, that feels really supported.
Right.
Okay, so that's the feeling people get because it's something a little different.
In fact, it's just the perception.
Yeah,
the
and it's
feedback
actually
of-
doing
yeah, that's
something. The
quite
brain's
interesting.
going,
Yeah.
okay, yeah, that feels good, and people react differently.
Yeah.
Some people, I think, they'll have them for a week and they'll come back and they go, oh, yeah, I didn't feel anything.
Yeah.
But then you take it off and they go away for another week and like, oh yeah, I didn't realise that.
It was
It's
really
actually,
good,
yeah. So,
How long does it take to hold it, the tape around?
do you want me to tape your ankle? Or can I get to your knee?
I mean,
Yeah, sure. Whichever is good.
Yep.
how many days?
How many
Do you want an
days?
ankle or a knee?
Knee. Can you get that?
Yeah.
Yeah, that's perfect.
Yeah, they're a little bit older than that.
Maybe we'll grab a chair, or you can have a higher chair if you want. Yeah, one more comfy. Let's see. So it can last 3 days, 7 days, 5 days, 10 days, 14 days,
Okay.
depending on
Depends
on how someone cares for it
Okay.
and where it is on the body as well.
Okay.
Yeah. So if we had, most people will say, so if we're taping a knee, a lot of people say, I'm sore here, or I'm sore here, or I'm sore here. So the number one thing is to cover the area of soreness. So if you just do that, you'll be 90% ahead of most people when they put tape on. So we measure up and go, okay, we'll just imagine it's sore areas.
Yeah.
Okay. Is it?
No. I know I sometimes get. So I've got Baker's cyst.
Oh, okay, yeah.
So sometimes I do get pain. I'm just like, am I painful? I'm going up and down ladders,
Yeah,
but
gotcha,
I'm
gotcha,
actually
gotcha.
okay.
We're going to cover that area. Yeah, so I'm going to measure up. There we go. And then we cut. So we always round the edges as well, and it helps the tape stay on a little bit longer.
All right, does it?
Yeah, so the edges don't catch. So that's why I've got scissors. We just roll around the edges like that. So we've got 2 there. So we try not to touch the tape. So we rip about centimetres or inches, about 1 inch from the end. So rip there and pull, and then we got there.
Yeah.
Good. And then we lay that on. Do that little press down. We pull. Now there's a few things we can do here. It's stuck there now.
Yeah.
We can go around the corner a little bit. We can pull it up really tight. We can back off. Usually when we're putting on tape for pain, we got the joint inflection. So the joint is here. If you're doing a back, someone's flexed over. So we don't have to pull this too much. I'm just putting a little bit just to go around the corner, and then we'll come back there. And then no stretch anywhere on the end of the tapes, because that'll pop off. So just nice and relaxed like that. And you could just leave it like that. That's easy. End of treatment, someone came in for a sore knee, you'll do all their knee, maybe do a little bit around the knee, and then right at the end you just put on a bit of tape. And usually you just say, can I put on a bit of tape for you to go away? And I go, oh okay, what will that do? It might decrease the pain a little bit over time. You can take it off if you don't like it.
Yeah.
And they'll usually go, yeah, sure.
Okay.
I'll do the whole knee, so we'll go on the other side, we'll measure the other side. Cut, and we will round. I did do that one wrong slightly. Can you pick up what I did wrong? No, the rock tape's upside down. So.
All right. I'm like, I can see it really well.
Marketing's important.
I can see well.
Rock tape originated in the US. So it's all about marketing.
Okay.
Yeah, that's why we've
Well,
got
it's
that.
right information looking at it.
But for her.
Yeah, it's perfect. Yeah, for other people.
Because for her, you do it for her, right?
So normally, most of the time we want to try and get tape on skin, not tape on tape, but tape will stick to tape on tape, so it doesn't really matter. We'll put there. I'm going to pull that a little bit, that'll pop up. I grab the last little bit, and then I can go around the corner here. So we just want to catch the edge of the kneecap there.
Yeah.
And then back off. So we just got there, and we just push that down there. So we got that. Then normally for a knee, we might do a piece here as well. So just a cross piece, and I'll show you what that does in a minute. So this is called decompression, but it doesn't really decompress. It's just a name we've got for it. We round the edges here. This is just another technique we use as well. So we use as a band-aid. So we rip in the middle, and we go both sides, and then we can pull like that. I'll do it upside down. Pull like that a little bit, and we just pop it across there. So normally, I'd probably do the full knee on most people, but you could just do one strip here. You could just do one strip here. If they were just sore on that, you could do just this strip here. Yep. And Liz, you're a long way off being a grandmother, but I'll get you to stand up for me.
Thank you.
But you have got a granny's knee now.
Yeah.
I do.
Okay, so biomechanically, there's a little bit of a biomechanical effect there. So there's 2 effects. There's a neurological, you can stay there. See? Yep. Neurologically, the tape's on the skin, so the brain starts doing stuff. It starts focusing on what's going on around here. Yeah. And some people can't feel it. Some people can feel it. But the other effect is there's a biomechanical effect. And we can see that going on in the knee. There's a lifting effect when you go in and out of flexion.
Yeah.
So there's a lifting effect, so it's actually lifting the tissue. So if you can imagine someone's knee, there's a bit of tissue cord that's just aggravated and just rubbing. What it might do is just slightly change the tissue as you move and stop that irritation as well. So that's a biomechanical effect, but it's a very small effect. So you have a change of just a millimetre in tissue might actually change the feeling of what someone's feeling in their knee as well. So that's pretty much how tape works. It's a really good example on the knee because you've got a bit of everything going on.
Yeah.
Other things that we tape, backs are really common.
Yes, I've seen around the ankles, you know,
Yeah.
people that have the back
Calves, yeah.
taped as
Yeah.
well.
Yeah, lower backs. So lower backs are pretty. So the most common ones I do are knees, shoulders, and lower backs. Yeah, occasional jaw.
Oh, wow, that would be interesting.
So, but in terms of pregnancy, ladies who are pregnant.
How would you take pregnancy? Oh, look at that. That's a big one.
So this is what we call Big Daddy. This is
Big
double
Daddy.
the size.
Yeah.
So this is 10 centimeters. This is 5 centimeters. This is 10 centimeters.
So would that be around the back?
Yeah, we just put one strip
Yeah.
across the back.
Yeah.
So again, it's inflection. Someone's inflection,
That
and
would
then we
feel
put
quite
the tape.
nice, actually.
Yeah. So it's kind of described as in someone's just cupping your knee
Yeah.
like that as you walk.
Yeah.
It's the same with the lower back.
Yeah.
Someone's just cupping
That
you
would be quite-
as you walk around. And because you put it on inflection when someone's bent down,
Yeah.
when they go into extension, the tape will ripple a little bit. So when you extend your
Yeah.
leg out, see that rippling
the
of the tape?
ripples, yeah.
So that happens in your lower back, and you get a slight biomechanical
Cool.
lift of the tissue.
Yeah.
So if that tissue is getting a bit aggravated, there might be a little bit more movement there if it's bound down. But also you get that feedback from the tape as well. So the brain just slightly may alter what's going on in the lower back.
Yeah.
Some people don't like it. Some people think it's annoying or whatever. But a lot of people will love, especially pregnant ladies, for a bit of relief.
Yeah, I can imagine that would be quite nice in a way.
Yeah,
You
yeah.
know, especially
Again,
the thick one.
yeah, it depends how sensitive you are as well. So the original kinesio tape made in Japan was a bit thinner than what Rocktape is,
Okay.
and also not as stretchy. So the thing is, I suppose, when it was westernized a little bit more, people with Japanese culture generally tend to be a bit more sensitive, actually more aware of their body, maybe traditionally, whereas Westerners maybe not.
Yeah.
And so we may have to, for us to feel it, we've made it thicker and stretchier. That's the kind of difference between this tape and the original kinesio tape. It's just stretchy and a little bit thicker, which has the bonus of it stays on the body longer as well. But patients have got full control, clients have got full control, so they can take it off whenever you want. I just say if it annoys you, just take it off. If it gets itchy or if you have a reaction to it. And usually the reaction is the dye in the tape. It's not so much the glue. So Rocktape, kinesio tapes come in all different colours. So the person might actually be allergic to the colour of the
So the
tape.
colours makes no difference, so to speak. It's not like thicker or thinner or anything.
Well, there is a thing called colour therapy. Yeah. So the original, and you can still get obviously rigid tape that I grew up with. Rigid tape was to keep
Because
something.
I see blue and green.
Yeah,
blue and
all,
red,
all
I
different
think.
colours.
Yeah.
But rigid tape was beige.
Beige.
The original beige,
Yeah.
rigid tape, and still is. Yeah, you can get white now.
Yeah, somehow in my head, and this all has to be beige.
Yeah. So,
Right,
and traditionally, beige for me is rigid tape, and it keeps something still.
right.
Yeah.
So what we've done here with Rocktape is to make stuff colourful, so it's designed for you to move.
Right.
So our job is to get people moving,
Yeah.
pain-free. So colourful.
It's quite vision. It makes sense, isn't it?
Yeah,
it's
yeah.
like stimulate.
Yeah,
and
yeah, yeah.
So
Yeah, that's right.
up
Yeah,
here.
yeah,
And then also feel it.
yeah.
It
Yeah.
just like being supported.
Yes.
Just go like this.
Yeah.
I'm fine.
Yeah,
Yeah.
that's right.
Something like that.
Yeah.
Yeah.
So at the end of the day, it's a tool to put on the skin. So the idea that we do in the courses is to actually teach people different variations in different parts of the body to actually get the tape on the skin and get it to stay. That's the most important thing. I think as practitioners, what we do is we want to control the outcome of things. We have a thesis, so we postulate what's going to go on with our treatment, but we never really know how someone's going to respond
No.
to treatment. So you could do exactly as we said. You could do exactly the same treatment,
Yeah,
2 days in a row.
yeah.
You know, you work on someone and you think it was great, and they walk away and they think it's great, and then next day they're really sore.
Yeah.
And you go, what? You know.
But it could be anything else
Yeah,
though.
yeah.
You know, mostly it's not that thing, so it's something
Yeah,
small.
yeah. There's
You know what I
other
mean? The
variables.
massage, even that.
Yeah, yeah.
And then something is going on,
Yeah.
and a little bit activated,
Yeah.
but maybe, and then
Yeah.
the people think, what happened? Oh,
Yeah.
massage.
Yeah.
That must be.
Yeah.
It's just kind of the mindset.
Yeah.
It's just targeted on the easy.
Yeah. And as a therapist, you can't really control someone's outcome.
No.
You think you can to a certain degree,
True.
but what the only thing you control is the stimulus you apply to someone based on your theory of how they should respond, based on however many out of seven to 10 out of people might
Yeah.
respond like that, but there might be the 3 that
And
won't.
then also people believing
Yeah.
or not believing.
Yeah, for sure. Yeah.
It's a big difference.
Yeah, yeah.
If people know, oh, Rocktape is good, right? And then so it's just done.
Yeah.
Even me might do it, and then you do it,
Yeah.
and then so such a different, but
Yeah.
mine could be work because people believe it.
Yeah, exactly.
Does that make sense?
Oh, for sure.
Yeah.
I mean, unfortunately, a lot of healthcare is actually selling. It's marketing. It's how you market
Yeah.
how your treatment's going to
Yep.
work.
Yep.
But you got to follow that up as well. Obviously, you got to put in the work. But to be able to, for an outcome, for this to feel better, I'm hoping that's going to happen.
Yeah.
I provide everything, the tools and everything.
Yeah.
But I can't control your brain.
No.
Yeah.
No.
So
Yeah, yeah,
I'm not controlling the outcome. I'm just controlling
yeah.
what I can
And I
control.
might get better, go out and
Yeah.
fall over.
Yeah.
Yeah. It's like,
Yeah,
oh.
I certainly, based on maybe what I've done with other people, that this
Yeah.
works quite well.
Yeah.
Yeah.
And I have a theory that this will be good for you.
Yeah.
Will get you moving pain free. If it doesn't, then we didn't spend too much time on it. We just spent a couple of minutes.
Yeah.
Yeah.
And that's all.
Yeah.
So controlling outcomes, is an important thing. But we're just applying the tool, so the brain will do the rest.
Yeah. You combine the massage and the tape
Yeah.
after that. So you do oil
Yeah.
for massage
Yeah, yeah.
and then
So will they
wipe it
stick
off.
on oil?
Yeah, so I use.
You'd have to wash this off if you're going to stick
I use.
like a physio cream. Or I got
Uh,
some massage cream.
Normally, what do you do? And then oil or
I use
like
wax.
a pink wax,
yeah.
magnesiums.
Yeah, we have rock
Oh.
rub, which
Rock
is just
rub.
we got everything.
Everything
Which is
has to be locked.
this one's quite old, so I don't use it. But it's just canola oil and beeswax combo.
Okay, cool.
I use wax rather
Yeah,
than
yeah.
oil. This comes in big tubs as well.
Yeah.
So this you have to clean the leg
Yeah.
off before you put the
Wipes?
tape on.
Yeah, no. So in my clinic, I've got towels, obviously. So, but I just make a towel, hot wet towel.
Maybe
Yeah.
Rinse it.
microwave.
No,
and
just under hot
doesn't-
water.
Oh, okay.
Yeah, just
Alright,
rinse it.
Just
Rinse it and then just wipe it over.
Yeah.
And
And
use the other
dry?
side of the towel to dry.
Yeah.
Yeah.
Wait a minute, wait
Yeah.
a sec, and then just put the tape on. It'll be
Yeah.
fine.
And then on.
Yeah.
Cool.
You don't have to use anything special.
Yeah.
Yeah, just wipe it off. It'll work the same with any oil.
Okay.
Yeah,
Okay.
yeah. So not a biggie. With getting water on it, so you can get that wet. It's not waterproof, but it's just cotton, so it's going to dry
Yeah.
in.
I might peel off after a while.
Yeah, it's going to dry in a couple of minutes. So you get it in a
Yeah,
bath
shower.
or shower. Just pat it dry, and it'll be dry in a couple of minutes. Yeah, but yeah, it will degrade over time. If I took it off now, it would be easy to come off. But if we tried to take it off tomorrow, it'd actually be stickier.
Oh,
Yeah.
It'll be
okay.
harder to get off
Yeah.
tomorrow.
Even have an after shower and then dry off and then
It's
could
fine,
be
yeah.
3 days,
Yeah, yeah.
4, 5
Yeah, yeah.
week.
Yep, depends on where it is again. Knee's not too bad. If it's on the ankle, it won't last very long because it's a lower movement.
Yeah.
Shoulder is depending on where you have it.
Which
Lower
way
back,
and then
yeah, and how rough you are with it, and if you're dragging close over the
Yeah,
top
yeah.
and down. You'll
Yeah.
catch the edges and
Yeah.
that. So
Yeah.
with
Yeah.
tights.
Understand.
So the idea is to learn how to put the tape on, and for it to stay on,
Yeah.
and then the brain will do the rest. Because there have been studies on placebo taping
Yeah.
as well. So the taping one technique like that, and then just putting up like a piece of tape anywhere, but it actually doesn't work because again, anytime you've got tape on the body, there's a reaction,
Yeah.
there's a response.
Yeah.
Yeah.
And,
Yeah.
and the eyes have also seen it.
Yeah,
haven't
yeah,
they?
Yeah.
that's right.
So you've
yeah.
got the eyes and
Yeah.
the brain
Yeah,
that's
yeah.
saying it's
Sense-
there.
Yeah, that's
And
right.
any different color,
Yeah.
it makes different way.
No.
No?
So
Doesn't matter?
our original kinesio tape had sort of they had a black, a blue, and a pink or reddy colour, I think.
Yeah.
So they sort of said like the blue was a cooling effect.
Yeah, yeah.
So usually, but
More like for before the sports or just
Yeah,
go
maybe.
fire
Yeah,
kind
but-
of.
colour therapy, definitely kids colour therapy. So we make one for surgeries for kids for feeding tubes and stuff, which has bears and animals on it. So and
Right.
it doesn't have
Yeah.
as much glue, so it's easier on the face
Yeah.
when you've got
Yeah.
a feeding tube.
Yeah.
And that sort of thing, and easier on the skin. So
Yeah.
there's 3 strengths of glue. We've got that one, which is standard. We've got a H2O, which can be used in water.
Yeah.
So you've got water sports, so it's got more glue on it. And the RX one, I think it's called, it's got less glue for kids
Yeah.
and people more sensitive.
Mm.
So yeah, for elderly people with
Yeah,
More
elderly and
paper.
kids, hey.
and elderly people with paper skin
Mm.
kind of things as well. So
Still work for the older people.
yeah,
Yeah.
sure, yeah, they love it. Osteoarthritic knees, bad knees,
Yeah.
is just a go-to, right? They just love it.
Yeah.
Yeah, on knees and lower backs, and
Yeah.
and so you'll be able people come back and you just take my whole body all over my tape,
Yeah.
just mummify me.
Yeah.
Yeah, it's pretty common.
Yeah.
Yeah, which is nice. But I mean, you'll call me. So if I tape Liz today, and she comes back next week, and she goes, "Oh, it feels really good. Yeah, I could exercise a bit more. Could do my exercises.
Yeah.
Great. Yeah, we want to get you moving. Let's tape it once more time. We'll do another week in that, and then come back after that, and then we'll see how you are, and then we'll leave it without tape, and we'll see how you go.
Mm.
So it's not indefinite.
Yeah.
It was just a tool. So we want to initially get someone moving, pain free. Our job is to get people moving.
Yeah.
So the better people can move, whether it be pain free, whether you use massage or cups or whatever, then tape. We just want to get people moving. Yeah. So that's pretty much in a nutshell. It's actually not too complex. The actual teaching is just learning to get the tape on the skin
Yeah.
to make it comfortable and get it to stay.
Yeah.
And that's
Yeah.
pretty much what we
Yeah.
teach people to do. Yeah. So
So
depending on the area of the body.
Legit, do you Rocktape is the one same way to quite like a kinesiology
Yeah.
type, right?
Yeah.
You don't have a rigid tape kind of
If we what's that?
rigid tape. Sorry.
Rigid tape?
Yeah.
Rigid?
Rigid.
Yeah.
No,
sorry.
no. It's all flexible. It's all the same.
Okay.
Yeah. We don't have
Yeah,
rigid tape.
okay.
Yeah. It's all This kinesio tape. Interchangeable. We use kinesio because that's the original name of a flexible tape, I suppose. But it's Rocktape is
Yeah.
the brand name, obviously.
Yeah.
But yeah, they're all the same. They're all flexible. The only difference is the glue
Yeah.
and this size.
Yeah.
That's the only difference.
Yeah.
We do have a paper called when it's got no colouring, and hemp. We've got hemp. We've got a hemp tape.
Oh, really?
Yeah. So, but it's the same glue.
Oh,
You still have to have glue.
yeah.
So it's just a hemp tape. So it's not cotton. It's hemp. Yeah.
Would that be stronger? Is hemp tape stronger?
No, I don't think
No?
so. It's pretty strong.
Yeah.
I have seen someone break it. I put it on their back, and a big guy, and he just went like that and just ripped in half.
Oh, really?
Yeah.
He must have been a big dude.
Yeah,
Yeah.
CrossFit dudes.
Yeah.
Yeah.
And so it's a good tool to have to add to your kit bag just to be able to support people with pain. Is that really the main thing? Is it about supporting pain?
Yes. Yeah. It's a pain. For me, I use it for
Not
pain.
supporting pain, but
Yeah.
helps to relieve pain.
Yeah,
That's probably the best way to do it.
And so that my job is to get people moving, pain free, and so I'll use whatever means I can to do it.
If someone that's a sports player and then got the injured, but I want to get in the field, do you depends on the situation, right?
Yeah, normally if they've rolled their ankle or you'll go to rigid tape to support that.
Okay.
But again, we talked about that will only give limited support. It's more psychological.
If it's the rigid tape, it's just some. If I look at some of the people doing that, looks so tight.
Right?
Right?
And that's the idea.
And then, but if too tight, and it's still okay, you know, sometimes
I mean, people
you say
proficient
they still move,
right? The joint will
it's
still
gonna
move.
be
The
it's
joint will
gonna
still
be
move.
once and then start moving and losing. It's
Yeah.
good to be
Tight.
good tight.
Right? I
Right?
mean, you can turn this into rigid tape quite, relatively easy. So,
Double it up.
you could wrap a lot around it, around the knee. Like I could make that knee pretty immobile.
Yeah, you could just
depending
add
on-
more.
and then if
Like a plaster.
I make it because it only pull to there. So that's rigid tape now.
Okay.
Yeah.
So I could turn that into rigid tape if I wanted to. But it's not my goal to keep something still.
Yeah.
My goal is to get people moving.
Because that still doesn't help the body. It's still.
It's still not getting its full range. And you might want to limit range for a little bit, but again, tape will give, rigid tape will give over time. So I'm just providing a different stimulus to the brain. So that's what I'm doing. So again, like a heat pack, like a cold pack, which have physiological effects, but also receptor effects. So change the sensation. So I'm trying to change the sensation so someone can move a bit better.
I wasn't interested in Rocktape before, but now I want to take the class on my own, actually. Maybe I should add it to my little kit bag.
It's like any tool. I mean, if you don't use it, you kind of lose it. So I kind of stuff. If anyone comes in and said, "Oh yeah, I've got a bit of sore back or I've got a sore knee," and I'm like, "Oh, I'm just gonna,
tape it.
I'll put a little bit of tape on then. Is that all right?" Well, you can take it off if you don't like it. And like, no worries. And it doesn't. It like costs whatever for a piece of tape like that, a few cents. But the more you do it, the easier it is. I suppose it doesn't.
I'm really intrigued now. I've always been a bit like, it's mainly for sports. I don't do sports. Not anymore,
I mean, 95% of people I see are
but I have a lot of people come in
chronic pain, chronic conditions, elderly people over the age of 60. I'll probably, if I work 5 days a week, I'll whack tape on someone. 3 days a week, I'll put tape on someone.
Interesting. Come and
So,
have to do a class.
One of that one tape on and then next couple weeks and then off and then back
Maybe.
on. Depends on
Maybe. It depends how often you see someone as well. So general instructions I'll give will be try to leave it on for 3 to 5 days. If it annoys you, take it off straight away. If it gives you a rash, whatever, take it off. Otherwise, the general instruction I give, leave it on for as long as you can. So that, and then some will come back like 2 weeks later, like 14 days later, and they've left this tape on their ankle, and it's not nice. Like, because it's been wet,
Skin,
and it's just
skin
like,
problem.
and like, can you put a new piece of tape on that? And I'm like, I'll just cut that one off, and it, the tape walks out of the room by itself.
I'm just looking for your courses, but I can't see it.
Rocktape Canberra, Rocktape Australia, not under my website. It's a different. Like I do work for them, so it's not under my. You just look up Rocktape. And the courses, it's 8th of November in Canberra, I think.
Normally you do at UC.
Yes. Just because there's a lot of set up tables there ready to go, and there's a good big projector, and it's.
Is that one that's HQ? So you see in the college or Where's about?
Yeah, University of Canberra.
Yeah.
Yeah, it's in the physio department, so in one of the lecture theatres.
Okay.
November the 8th, that's the day of my expo.
Ah, yeah.
I'm quite
There'll be one in March.
next year.
March,
It'll
April.
probably be next year. I'm intrigued. I'm super intrigued.
Yes. Anything else about tape? Which covers it?
I think that. So look, it's interesting. There's the one
yeah.
for the back and the neck.
Yeah.
So would that be good for your, I feel like it's like the 21st century issue, isn't it? Everyone's just on the computer,
Yeah.
They extend their neck,
Maybe
lean over.
Maybe in the Canberra.
So is that quite? Yeah, especially Canberra. Yeah, I mean, I get so much stress and neck thing. I'm just like, actually, I could probably take all of my clients doing that.
There's
wow, that's the one.
yeah, there's one that it's a bit different. So you can
my
use
body again.
I'll just show you on your ankle actually.
Okay, ankle.
So we'll talk about the neck in a minute. So I just want to show you edema taping. So if you've got someone who's swollen, then we want to make what we call jellyfish. So we make jellyfish like that.
Okay.
And I'll make another one. If you've got really sharp scissors, you can cut these
Quite thick, isn't it?
together. Yeah. So this is what we call a jellyfish, and you can use this on swollen ankles, swollen knees, for lymphedema as well.
How do you want me?
Yep, that'll do. Can you cross over? Yeah, that's it. They move a lot, don't they?
Yes, I'm very double jointed.
Maybe we'll do it this way. See, so we'll go there, and then we will reply. So you can imagine this is a big swollen ankle.
Okay, yeah.
So we were trying to reduce the swelling in the ankle. So we will cover the area of swelling like this. Let's go. No! That's not supposed to happen. That's right, just imagine that didn't fold on itself.
Okay, yeah, we didn't see it, didn't happen.
No.
It's totally fine.
Missed it.
You've got it in the right direction for wording, doing good.
So we cover the area of swelling there, and then we
Yeah.
basket weave it like this.
Yep.
So we break the head off that, pop that up there again.
Okay.
So we'll put this on this side.
Oh wow, that's cool.
Yep. So, put that on there. Yeah, this can be done on knees. It also can be done on ankles. Anywhere there's a swelling on the body. And talking about this because there we go. See that? Yep. So it's just like that. You're covering all the swelling. So in terms of sporting injuries, so if they rolled their ankle, you try and get this on as quickly as possible. Okay, so what it seems to do, we don't know exactly how it works, but it seems to strip the lymph build up, the swelling build up there quicker than normal. Than it would normally flush
super
through.
Great.
So when in massage, what you would do, you would flush through the lymph and try and here and push it up or whatever. So here we're using the tape to do it. So you do it in the session, but then let's put the tape on
Then you tape on after.
and then as the movement goes. So to move lymph, we want joints to move. That's a lymph pump. So we want people to move. That's why older people who have lymph issues, who don't move, they build up through it. Because they're not pumping through the body. So we want this to pump and move. So this actually, we don't know exactly what it does, but it seems to make the lymph channels more efficient for some reason. We don't know why. Because if this is bruised as well, and we take it off in a couple of days, you'll see no bruising under the tape, and you'll see bruising where the tape isn't.
That's
and you can just Google tape and bruising, and you'll see all of those. Just Google that. And
I'm intrigued now.
yeah, so if this was big and black, I said
Yeah.
we'd leave it on for about 3 or 4 days.
Yeah.
You take it off, and you'd actually
Have
see
a crisscross, but the other way.
but you'd see the bruising. Yeah, you'd still see the bruising crisscross. So there'll be no bruising
Yeah.
under the tape.
Yeah.
Yeah, and you'll see a slight divot as well where the tape has been, like a slight channel.
Mm.
So it's actually flushed through there underneath. But we don't know whether it's a change in pressure from where the tape is and where the tape isn't.
Mm-hmm.
So yeah, we don't know why it works, but it does work. It tends to work better than putting one big piece, piece over there. Doing it like this seems to work better for whatever reason. Yeah.
How intriguing.
Yeah. So when the neck got to that, we're talking about the neck, and you saw the neck one.
Yeah, this one. Yeah.
Yeah. So what I tend to do, people usually.
Yeah, that one.
Yeah, you can put tape on people with sore neck or chair warriors and that sort of stuff. But what I usually someone would have whiplash.
$250. That's pretty good for a course.
For the course. Yeah.
Yeah.
So,
How long to go? That one?
That one's on the 8th of November. I can't do that, but I'm now intrigued to do one in March. Just like,
Yeah.
My issue is, shiny thing, new thing to learn.
Yeah.
May or may not need it, but
Yeah.
when you learn it, you always need it.
Yeah.
As soon as you learn it.
Yeah. Next person will come in and
Yeah.
bloody saw that.
Yeah, you're like, oh,
Like, what can I do?
I've got something more I can do for you.
Yeah, I mean, that's what you ask yourself as a practitioner. What else can I do for you? What else can I send you somewhere else? Can I refer you?
I love it.
Too.
Yeah.
It's
what
better
else can I do?
business,
I
right?
just recently learned Psyche. It's freaking awesome.
So that's a really fine one.
Yeah.
And when I'll do that is I'll put that at the back of the neck, like that. Like right at the back of the neck, like that. Yeah. In a flex position. So when they actually go to move, again, it feels like someone's cupping you as you walk around, and it feels like really supported. Very neurological. So I've put that on people in classes, in the workshops, and they've gotten up and they've almost fainted because of how.
Give it a go. I'm super intrigued.
I'll do it well. You give it the whole effect.
Yeah.
Because it's so close to the brain.
Yeah.
Depends on how sensitive you are, of course, and what's going on in your neck. So you got to be a little bit. You got to be a little bit careful.
And I've been painting and sanding.
Yeah.
On the computer more than normal.
Yeah.
I'm intrigued.
So you have a really sharp pair of scissors. Do that. Alright.
Should I turn around for the camera?
Yeah, we'll spin around. Maybe spin the chair around. Yep, you're right. So we're going to go here. Yep, on one side, and then we try not to get the hair in it. Is that?
So you want my head down?
Yeah, just general, whatever's comfortable. So if someone's got a really sore neck, you don't want them to just be in comfort where they're comfort. So if it's a jellyfish, we put the head on first, and then we'll just.
So you're putting the head down, and it's coming up over.
Yeah, the tentacles are coming up.
Okay.
Yep. No, they're going to basket where they cross over each other.
Okay.
So I'm just spacing them about a few millimetres apart, or about one tentacle apart. So coming over. So no problem, feels alright?
Yeah. Yeah, I mean, apart from feeling you put it on, I almost wouldn't know it's on at the moment.
Generally when people say I can't even feel it, that's the best circumstance that you got. So, but everyone's different, so it depends on how much pain they're in. So like that. So that's one there. We'll tap these everywhere. So we break all the tentacles. Fiddly, but you get quicker as time goes on.
Yeah, as with everything, isn't it, once you're used to it?
Yep. So I'm just crossing over, get into the hairline.
Mm-hmm. Yeah, well, I'll put it on my. I did rock taping today.
Almost there.
Yeah, I thought I would feel it more, but actually, I don't. Interesting.
There you go.
All right, yes, as I bring it up, I can feel it.
Yeah.
Quite nice. Yeah, hold on. I'll get you to take a photo in my phone as
Yeah.
well. Cheers, Madeus.
There you go. So that I use that for whiplash. Someone who's got whiplash or a really sore neck.
Whiplash for a sore neck.
Yeah.
I like that.
Whiplash can go on for months and
Yeah,
months.
like I get, I've never had it myself, but I know clients really.
Yeah.
That's awesome.
Yeah. That's out of the box really. It's not mainstream that we teach, but there's all different things that we've developed over the years that I sort of teach.
Yeah.
My own little things that I teach. So. Yeah.
So you're one of the trainers at the courses, yeah?
Yeah, I run all the Canberra stuff.
Oh, okay.
Yeah, it's just me.
Yeah.
Yeah.
Julia.
Yeah, we got someone in every state, a few people in different states that run.
Yeah.
So I don't know how many courses we run. Probably all up in Australia, we run about 20 odd courses a year, probably more. In different states, depending, Sydney's, New South Wales bigger. We do it in the country. I used to go to the country.
Yeah.
Yeah. So there's a tape. I'll give you some tape, and you can play with it later. Tape your dog or your